You are watching your award-winning cable access station, Channel 13 and 19, Athol Orange Community Television.
Welcome to Quabbin Valley Health Links, a presentation of Quabbin Valley Healthcare in partnership with AOTV. This program is designed to link members of the community to health-related resources available in and around your local community. We serve to provide information on healthcare-related matters and other resources so you can make better, more informed healthcare decisions. Please visit us at qvhc.com for more information. Welcome to Quabbin Valley Health Links. I'm Michael Cacciadorian. Today's program is all about diabetes, and with me today is Denise Forsman, registered dietitian and the clinical manager of nutrition services and diabetes education at Haywood Hospital in Gardner. Welcome to the program.
Thank you, Mike.
Today's program is all about diabetes because it's such an epidemic in the United States. And my understanding is the CDC states that there's over 26 million people who are afflicted with diabetes and another 79 million people who have prediabetes. And overall, it's costing the healthcare system somewhere around $170 billion a year to treat these individuals. So I thought it was an important topic to discuss and also help people from this community understand what resources are available to them and how to access those resources. So I think first of all, if you could just take a moment and explain what exactly is a registered dietitian.
A registered dietitian is someone who has gone through accredited college and passed the boards, and then we can go on to getting our master's, which most of the dietitians do these days. And we are certified through the Academy of Nutrition and Dietetics, formerly known as the American Dietetic Association. So as a registered dietitian, we are licensed through the state to deliver medical nutrition therapy in clinical settings as well as in corporate and community settings as well.
So Denise, if you could take a moment and explain to people in a manner that they can understand, what is diabetes?
Diabetes is simply having too much sugar in the blood. Our bodies normally have to have sugar in our blood to be feeding the cells, and we get this through the breakdown of foods that we eat. When you have high blood sugars, that's indicating to us that we're not producing enough insulin, and insulin is a hormone that helps to carry the sugar from the blood into the cells. Okay. So we eat food, it breaks down into the sugar, it goes into the bloodstream, the pancreas releases the insulin and takes that food, that sugar, into the cells. By moving the sugars into the cells, it keeps your blood sugar levels normal. So we have a level that we always have a little bit of sugar in, but it keeps it within a normal range. Okay.
What is that range? Is there something that
range, basically the range is between 70 and 100, 70 and 99 is what they're looking at.
Okay. And we hear oftentimes that there are different types of diabetes. Could you just take a moment to explain what types of diabetes there are and some of the slight differences and even the similarities?
Yes. We have type 1 diabetes, type 2, pre-diabetes, and there are other non-specific types of diabetes. And we also have gestational diabetes. So type 1 is basically the insulin that I was talking about. The pancreas no longer produces that. Approximately 5% of our population has type 1 diabetes, and it usually happens before the age of 30. So this is what they call juvenile diabetes as well. So that's with the lack of insulin. So these people are going to need insulin injections to be able to keep their blood sugars normal so that the body can run at a normal level. Okay. Type 2 is when your body isn't producing enough insulin. Your body can become glucose intolerant or resistant to insulin. And a lot of this has to do with our lifestyle, and that's the way we eat and the physical activity. Type 2 can happen at any age that we're finding. Normally it's considered seen more in the middle age
Okay.
and elderly patients, but now we're having a dramatic increase of type 2 diabetes in the youth under the age of 20.
Is it always diet related or lifestyle related?
Mostly diet and lifestyle.
Okay.
However, there's other contributions too, which is going to be family history, race and ethnic groups. Also, there's certain that have more prevalence to the type 2 diabetes.
I see. So what are the signs and symptoms that people should look for? They're at home now watching. What are they looking for that they may say to themselves, I need to get looked at by my physician?
The three classical symptoms of diabetes is excessive thirst. They can never quench their thirst. Excessive urination. And also excessive hunger, because what is happening is the blood sugars goes to their bloodstream, but because without the insulin or the insufficient amount of insulin, it can't get to the cells. So the body is indicating that they're thirsty and they're hungry.
I see.
Okay.
And you mentioned about the differences between ethnic groups, and can you take a moment to describe what that is? What groups are more prone to diabetes or are at high risk for diabetes versus others?
Yes. When you break down the ethnic groups, and this is the data from the CDC, the Center of Disease Control, 14.5% of risk for diabetes is American Indians and the Alaskan Natives. 12.6 is Puerto Ricans. 11.8 is the non-Hispanic blacks, and 10.4 is Hispanic population. So these are the data that we receive, that those have more prevalence of diabetes type 2.
Okay. And how is diabetes treated in general? I mean, is it treated differently for the different types of diabetes, or is it a similar approach?
Well, with type 1, because they are deficient in the insulin, basically at some point before the age of 30 normally, but it can happen at any age, their body stops producing the insulin. So these people are going to need to have insulin injected into them.
Okay.
So that is a definite. There's no other way except to make sure they get the insulin, that hormone in them, so that they can take that blood sugar and bring it to the cells. Type 2 there's a couple of different ways of treatment. Many times the type 2 can be treated with diet and exercise. That's the preferred method for the first approach and treating it. And changing the diet and making sure the exercise helps to uptake that sugar and put it into the cells. The diet basically is looking at decreasing the amount of calories and eating more healthy.
Okay. Decreasing carbohydrates.
And
that type of
carbohydrates is the
situation.
major contributor. And then the other way too is with type 2 is a lot of them are started on oral agents. And these basically are medications. One that's very familiar to people is metformin.
Okay.
And that would be the first line of medication treatment for them to try to control their blood sugars.
So what's the process to get tested for diabetes? How do you go about that?
Well, this is why we have probably a lot of people who are out there who are at a pre-diabetic state and don't even know it, because they're asymptomatic. They don't have those classical symptoms of diabetes. So the way to get tested is a lot of times the doctors pick it up in the doctor's office when they do a blood glucose test. This is a fasting test. The person has to be fasting 8 to 12 hours, no food, just water, no other type of beverages. And when they see a level of 126 or more, then that's an indication of a possibility of having diabetes. They would have to repeat the test.
I see.
All tests repeated. They also have what they call a hemoglobin A1C, which has just been through the standards of American Diabetic Association in January 2013 as a standard to also test for patients to have diabetes. And that's a level that has to be 6.5% or more.
I see.
And again, a repeat of that test.
Is that something that has to be fasted, like a
A1C,
traditional test, or is that a blood test?
That's a blood test that does not be fasted.
Okay.
The hemoglobin A1C, basically they're looking back at a couple of months back as to see where the blood levels are. It's a very complicated term, but it's glycosylated hemoglobin, which means the blood cells is collecting the sugars around it.
I see.
So many times people who are diabetic, they'll be really good for 2 weeks, prior to coming to an appointment with their doctor, but when they do the A1C, that truly tells what that patient's
see.
blood sugars have been
Interesting.
in the last 2 to 3 months.
Interesting.
Yeah.
And I think to that point too, it's important to maybe state here that if you are going to your physician, you're having your annual physical, and the physician wants you to fast because you need labs, do it.
Do
and
it.
don't bypass the lab. I think some people tend to maybe circumvent having the lab work done. They go for their physical, and the doctor
That's
never
right.
receives their
Right.
lab results because they never had them drawn.
Right,
So the
right.
importance of doing that fast and making sure you get tested
True.
for diabetes.
And another thing is too, what we're finding with the type 2 and also with the pre-diabetics. The pre-diabetics, as you know, is the rate of that increasing is huge. Basically, these people don't have those symptoms, but the blood test that we're looking for is, it may show up in the blood sugar like 100 to 125. Doesn't mean they're diabetic, it means they're in a pre-diabetic state. We also are looking at their lipid levels, so the blood levels, like the cholesterol
Okay.
and the good cholesterol, the bad cholesterol, and seeing where that's at, as well as the triglycerides, because triglycerides are very important. In fact, the glyceride is a sugar molecule which has 3 fatty acids on it. So basically, if you have a high triglyceride, then there's more apt chance of you having a pre-diabetic state.
Are any of these curable or preventable in the first place?
Diabetes is not curable.
Okay.
But the American Diabetic Association made a position statement back in 2002 that type 2 diabetes can be prevented or prolonged with the diet and exercise.
I see.
So that is your first line of defense, is trying to see, and losing, the obesity plays a part in that as
Right.
well. So even if just losing 10% of your body weight, we're not looking like big numbers, we're looking at 10% of your, 5 to 10% of your body weight, you can decrease your risk of diabetes and cardiovascular disease, which goes along, unfortunately,
Right.
with that.
So a person with a primary diagnosis of diabetes oftentimes has, as a result of that, other medical issues that are going on with them, other diagnoses. What are some of those complicating factors as a result of having diabetes?
We found that a lot of the diabetics have, number one, is cardiovascular problems or heart problems. And when I say cardiovascular, we talk about heart, we're also talking about the blood vessels. With the high blood sugars, or sugars being out of control, is that it causes those flexible vessels to become more rigid. And when they become more rigid, then there increased risk of plaquing and also increased risk of high blood pressure.
And both you and I were in the healthcare profession. We always tend to associate diabetes also with people that have vascular problems that result in wounds, most notably a lower limb, wounds on their lower
Yes.
wounds on their lower limbs. Is that always the case, or is that?
Again, it depends. What happens with diabetes, the 3 classical complications are, number 1, retinopathy, where they lose their eyesight. Number 2 is neuropathy, which is their nerve damage. And then the third one is nephropathy, which is the kidney damage. Those are the things, the organs and the system that gets affected first and foremost. But when it comes to wounds, what happens is that there's because it's vascular and it's being affected, that a lot of times they have wounds on their legs and pressure ulcers or diabetic ulcers on their feet. Could be from the fact that they hit their foot on something, don't even realize they hit their foot because they have nerve damage, not feeling it. So whenever there is some sort of a hit or something on the foot and it doesn't heal, then we run into trouble because the fact it becomes a serious wound, a problem.
So I would think that it's a good idea for people to maybe at the end of the day, as they're unwinding, just take a quick look at your lower limbs, have somebody look at your feet, make sure you didn't step on something, just make sure everything's good, just to help prevent.
Yes, what we do is part of our education is we have a checklist, the daily checklist, and basically checking, did you check your feet? Did you check your blood sugar? Did you check to see, did you check where you're at? Did you do your medications? We have this checklist when we do the education so that it reminds the patient. Very, very important to take your socks off and look at your feet. And also what happens is that the diabetics tend to have dry skin. So we make sure they get, put some cream on, because if you keep that skin moist, it's better. It's a barrier protector for your feet.
So I think most people, I think it's great that Haywood Hospital is working to really ramp up the level of services they're providing, the types of education they're providing, wrapping Athol Memorial Hospital into that. I think so many people, though, just based on our discussion, don't comply with what it is the doctor wants somebody to do, what their registered dietitian needs them to do in terms of their diet. Why do you suppose that is? What are we seeing that contributes to somebody not having a more successful outcome and living a better quality of life with diabetes?
Diabetes is a chronic disease. When someone is diagnosed with diabetes, there's no cure. So they have to live with this chronic condition for the rest of their life, and they have to make those certain changes, and it's hard. It's hard to make behavioral changes. So the non-compliance could be with not wanting to count your carbs and look at how many carbs you have. Medications, we look at the socio-economical situations that some people are in that also contribute to the non-compliance as well.
So what are some of the things that Haywood Hospital is doing on the education side of this issue? How are they bringing this resource to Athol Memorial Hospital? And how can somebody access this information?
Well, Haywood Hospital right now, we have a certified diabetes program. We're dual certified with the American Diabetic Association and the American Association of Diabetic Educators. And by having this dual certification, it has enabled us to be able to bring the program, which is hospital-based, out into the community. So at this point, we have done a lot of community outreach types of programs as well. The program that we have is called Diabetes Self-Management Education. It is a comprehensive education that we do. You have an initial assessment where the patient comes in, we assess them to see where they are, do a health history questionnaire, work with them, see what their concerns are, and try to customize the next 5 sessions on their needs. But what these sessions do is teach them, gives them the tools and teach them the skills to change their behavior and to help them manage their diabetes. Whether it's meal planning, we go over meal planning, stress, medication, coping, physical activity, all of this is done in the whole program. And then once they complete the program, then they will be coming back for a follow-up. And also, once they complete the program, we try to offer them different resources. We have cooking classes that we're offering once a month at night. We have another cooking class demo that we're doing right at the hospital to help, to help them, work with that.
And these are some of the programs that eventually will move into the Athol Memorial Hospital area over the course of the next several months.
Yes, what we're doing right now is we're looking at the expansion of taking the diabetes program and doing another hospital base at Athol Hospital. And they're doing some community outreach programs as well. We are finding that our area, the Gardner and Athol area, is one of the highest levels of, or the highest number of diabetics in the state and part of the country.
Well, I think it's important for people to know in this community that these resources are available.
Yes.
At their fingertips, and how can they reach you, or what number should they call to get more information to services?
At this point, the number to call is 978-630-6289. That goes right into my office phone. What we do is if people are interested in the program, in the diabetes self-management program, is to get a referral from their physician, have their physician come to, go to your physician and say, I have diabetes. I've had diabetes for a year, 2 years, 10 years. I'm not well controlled, or some things are happening, or changes in my life, that this would be the time to get a referral from the doctor, and then we would put them into the program.
I see.
And then as we expand out to Athol, the team of there will do the same thing.
Excellent.
So it'd be nice, because it will reach out and make it more convenient for the people in this area
That's
to
right.
be seen at a local hospital.
Absolutely. So Denise, if you can just also describe for us what is gestational diabetes?
Gestational diabetes is when the blood sugars are abnormal in a pregnant woman. Usually this happens anywhere from 14 to 24 weeks is when they start diagnosing that. The patient, or the mom-to-be, would be going through a what they call a glucose tolerance test. It's one of the typical tests that they do just to check the sugars at that time. If the sugars come to be too high, then they come to see us to control their sugars with diet and exercise mostly, and learn how to monitor their blood sugars. If that doesn't help, then we put them on medications that's safe for the fetus.
I see. Great.
Okay.
Well, Denise, this has been a great conversation. I think it's vital for people of this community to understand how serious diabetes is, but at the same time also understand how to access quality care, education, and support services in their local community. And I just want to let everybody know, if they want more information, they can also log on to haywoodhospital.org and also atholhospital.org. And remember, too, to check out Quabbin Valley Healthcare at qvhc.com. Thank you for watching.